We have already seen the representation of cardiac cycle by the circular diagram, in which the outer circle represents the atrial events and the inner circle represents the ventricular events. Now we will understand the mechanism behind these events. We will begin our discussion from this very point. That is, at the end of the atrial systole and at the end of the ventricular diastole. This is our four-chambered heart, in which this is the right atrium, left atrium, right ventricle, and left ventricle. The apex of the heart that is attached to diaphragm by a ligament. The atria and the ventricle, they are separated by an AV septum. For our convenience, we will focus only on one side of the heart. We will concentrate on the events occurring in one side of the heart, though similar events occur on both sides of the heart. So we will see what events are occurring in the left side of the heart for our convenience. Our initial position is at the end of the atrial systole and end of the ventricular diastole. It means that at the end of the atrial systole and at the end of the ventricular diastole, the AV valve is closed, and similarly the semilunar valve is also closed. Because of the atrial systole has ended, the atrium is almost empty, and because of the ventricular diastole, the ventricle is almost filled with blood. Now imagine a situation when the ventricle starts contracting. When the ventricle starts contracting, this AV septum is pulled down as the apex of the heart is attached to the diaphragm. So this AV septum is pulled down. Now we can see two implications of this event. Due to the pulling down of AV septum, we can see that the size of the atrial chamber has enlarged. It means that the pressure inside the atrium has decreased, and due to a low pressure zone created in the atrium, the blood is sucked into the atrium. Hence, atrial filling occurs. Filling of atria is known as atrial diastole. We can see the beginning of atrial diastole here in the circular diagram. We can see the beginning of atrial diastole in the circular diagram. Another implication of this pulling down of AV septum is that the size of the ventricle that has become smaller, which leads to increased pressure in the left ventricle. The increased pressure in the left ventricle leads to opening of this semilunar valve, and the blood ejects through the aorta into the systemic circulation. So, there is ejection of blood from ventricles due to the contraction of the ventricle. This is known as ventricular systole. We can again mark in the circular diagram the beginning of ventricular systole. So we have seen that as the ventricle contract, the AV septum is pulled downwards, due to which the size of the atrium increases and size of the ventricle decreases. The increased size of the atrium results in low pressure zone in the atrium, which causes the atria to suck the blood, which results in atrial diastole, and the increased pressure in the ventricle results in opening of the semilunar valve, which causes ejection of blood from the ventricle, which is known as the ventricular systole. So the ventricle keeps on contracting for 0.3 seconds, as we can see. So the ventricular systole lasts for 0.3 seconds. Now analyze the situation at the end of 0.3 seconds, that is at this very point, where the ventricular systole has ended and atrial diastole is still continuing. So the atria has been filled with some amount of blood, and majority of the blood has been ejected from the ventricle into aorta. Now the backflow of blood through the aorta leads to closure of semilunar valve. Semilunar valve closes. So at this very point, closure of semilunar valve, which produces second heart sound S2. Now the ventricles begin to relax. As the ventricles begin to relax, the AV septum is now pulled upwards. Now as the AV septum is pulled upwards, the diameter of the atria again decreases, and its pressure increases since it is already filled with blood and the pressure is increasing in the atria. This leads to opening of the AV valve. So AV valve will open. Due to opening of the AV valve, the blood will flow into the ventricle from the atrium. So ventricular filling will occur. This ventricular filling is known as ventricular diastole. So we can see the beginning of ventricular diastole. This ventricular diastole continues for next 0.4 seconds. In this period, the atrial diastole also continues. It means that ventricle is also getting filled with blood and the atria is also getting filled with blood. It is important to note that as the AV valve opens, blood rapidly flows from the atria to the ventricle. So there is rapid filling. rapid filling of the ventricle, or it is also known as first rapid filling. First rapid filling of ventricles. After that, there is slow filling of ventricles. Up to this very point. So both this first rapid filling and slow filling are passive filling of the ventricle. That is, without any effort of the atria, without any atrial contraction, the ventricles are being filled. So these are known as passive filling of the ventricles. Eighty percent of the blood is filled passively into the ventricles. Now, at the end of this 0.4 second, means at this very point, atria actively contracts. Atria actively contracts and further more amount of blood enters the ventricle. So in the last 0.1 second of ventricular diastole, the atria contracts to fill this ventricle, and this contraction of the atria is known as atrial systole. So for last 0.1 second, this atrial systole results in ventricular diastole. And this active filling of ventricles for the last 0.1 second due to atrial systole is known as second rapid filling. Now analyze the situation at the end of this 0.8 second, means at this very point. Ventricle is completely filled with blood and atria has almost completely emptied itself. Hence, the AV valve is now closed. So, AV valve is closed at this very point. The closure of AV valve leads to production of first heart sound, and the cycle further repeats. Now, two important points should be noted. In the beginning, we saw that as the ventricles contract, this AV septum is pulled down. So the AV septum, as it is pulled down. So when it is pulled down, the pressure in the ventricle increases. But at this very time, the semilunar valve is closed and the AV valve is also closed. The increasing pressure tends to open the semilunar valve, but the semilunar valve does not open instantaneously. It opens after some time, after a fraction of a second. And the phase when the ventricles have begun to contract, but all the valves are closed. All the valves are closed. Means the ventricles have begun to contract, but the blood is not getting ejected from the ventricles because of the closure of the valve. This phase is known as isovolumetric contraction phase. So, at the beginning of ventricular systole, there is an isovolumetric contraction phase. And when this isovolumetric contraction phase ends, then the semilunar valve opens. Similarly, at the beginning of the ventricular diastole, there is isovolumetric relaxation phase. Isovolumetric relaxation phase means the ventricles have begun to relax, but the valves are still closed. And at the end of the isovolumetric relaxation phase, the AV valves open. This completes our discussion on the cardiac cycle.